There are a lot of fun things about a road trip. The scenery, the sense of adventure, and of course the ultimate road trip music mix. On the other hand, there are a lot of horrible things about a road trip. The traffic, the "are we there yet?" your wife's need to stop for a bathroom break every 45 minutes. But as it turns out, there's a danger in pushing your family through a 6-hour car ride without a single stop, and it lurks in your legs. Because while you're flying along the interstate, your blood may be pooling in your legs, and that can cause a potentially life-threatening blood clot.
If you sit for many, many hours, at least more than 3 or 4 hours without moving around at all, then the blood may start pooling in the blood vessels in your calf, let's say. If it sits there too long, it can start forming clots in the calf, in the thigh, that is a persistent pain or swelling that occurs for hours or days after an event like that. It can also occur from trauma.
When a blood vessel is injured, the body does several things at once to repair the damage. The interior of a blood vessel is lined with a thin layer of endothelial cells, under which is a layer of collagen. When the endothelial layer is damaged, the collagen is exposed, and this collagen activates the platelets in the bloodstream. The activated platelets clump together, forming a plug. Simultaneously, proteins in the blood form a mesh-like net to strengthen the platelet plug and form a clot, healing the tear in the blood vessel. Clots happen all the time. You see them when you cut yourself, and within minutes the blood stops flowing and a scab starts forming. But blood clots within the veins are dangerous because the scab that forms there can actually block blood flow. Even worse, parts of this scab can break off, just as they do when you pick at your own scabs, and those pieces can float to areas where they can do the most damage.
The clot may suddenly break off and then start traveling up the blood vessel, just with the rest of the blood, and go from the right side of the heart into the lungs. And the lungs are accustomed to having just clear blood come through and oxygenating it. The lungs are not supposed to have thick clots occur in it, which can then damage the lungs or cause an insufficient amount of oxygen getting into your bloodstream.
It's important to see your doctor if you suspect a blood clot. We can do a lot to keep that scab from floating into your lungs.
We know that patients are better off taking blood thinners, a particular blood thinner called Coumadin or warfarin, that they'll need to take a few months to help the blood clot dissolve and make sure that further blood clots don't occur in that area, and that dramatically reduces the risk of the blood clot moving into the lungs.
You can also manage clots with anti-inflammatory medications, like ibuprofen, elevating the limb, and using warm compresses, which increases blood flow. Of course, you could always just stay active and avoid that clot to begin with.
If you know you have to spend many, many hours sitting, then you try to go out of your way every 2 hours or so to stand up and stretch your legs and walk for a minute or so. Even wearing support hose can be helpful. Something as simple as that can massage the legs and keep the veins moving a little better if you're going to be sitting in a prolonged situation.
Even though you hate to stop at the 100th gas station in so many miles for your wife's bladder, it might be a good time to get out of the car and walk around a little bit, for your blood's sake. I'm Dr. Keller Wortham, and you're watching the eHealth Network. We'll see you next time.